Hi everyone, Michelle from Virtual Hand Care here, your online hand therapist. So if you're having numbness and tingling of this side of your hand, I'm going to show you a gliding exercise that you can do for that nerve to help it move. A nerve needs to be stretched like a muscle does, but not as aggressive. The analogy I use is like flossing your teeth. So just like you floss your teeth and you move that floss between those small spaces between the teeth near the gums, your nerves also need to be flossed and glided and slide between the small spaces. Your nerve can get compressed in many different areas, and it's important to know which area is getting compressed. So say we're working on this side. So I've got numbness and tingling of my ring finger and my small finger on this side of my hand. So what we're going to do is we're going to depress the shoulder. So that means you want to raise the shoulder and then lower it down. Now, if you have numbness and tingling with this, don't progress anymore. And actually, you should just work on bringing that shoulder down into a gentle glide without getting numbness and tingling. You don't want to progress on because you can make that nerve worse. If you're here in step one and you've done some traction and you're not having increased numbness and tingling, stay here for a few seconds. Step two is now keeping the traction. Now what you do is you elevate and lift the arm out to the side, palm down. Hold this for a few seconds, and then you can progress to step three, which is then you come into the arm with kind of a salute. You have your hand just turned just a tad here. And then you hold this for a few seconds as well, still trying to maintain a little bit of that traction into the shoulder. After you're done with step three, you want to progress to what's called step four, where step four now is where you have the elbow bent and the wrist is bent, almost like you're trying to hold a heavy tray. And then to advance it then to step five, you want to bring your neck over and you can start to do a little bit of gentle flossing. So meaning you're just trying to slowly floss that nerve. You can do that way, or you can do it with the head over and then moving the wrist and flossing with the wrist back and forth that way. And then when you're done, you would just take a break and maybe just kind of shake that off a little bit. But if you're having a lot of numbness and tingling, you should have not progressed to all those steps. Let's do that again, one more time. Step one is depressing the shoulder, holding a few seconds, then raising it up into abduction, holding a few seconds, then bringing the hand to a salute, causing that nerve to stretch here, hold for a few seconds, and then bring that hand out, more out to the side, keeping the wrist back, holding that for a few seconds, and then finally bringing the head over to the opposite side, and then starting to do a little flossing with that. You can do it that way, or you can do it that way. Whichever is more comfortable for you. Okay, so you'd want to start with around 5 of those and work up to 10 if you can, but you want to do them a couple of times a day until you are not noticing any more numbness and tingling in your hand. Please like this video and subscribe to virtualhandcare.com if you're having a hard time with numbness and tingling, or for any other injuries that might be bothering you. Make an appointment with me at virtualhandcare.com. I'd love to help you out. Thanks for watching.